It's very important to understand that no piece of technology that I've ever brought into this practice has changed the way I practice more than dental lasers have, okay? It is just such cutting-edge technology, and it's really where dentistry needs to move. Lasers, when used in the proper way, are a tremendous asset for the doctor of getting the procedure done quickly, and for the patient because it's done in a much more comfortable way for them. Let's start with just regular fillings. Okay, most regular fillings, many of them, the patients don't need any anesthesia whatsoever. They're just not going to feel anything. And when we do it, and in addition, the white fillings that we place actually are better when the teeth are prepared with a laser than with not. Regarding gum surgery, I am doing just tremendous things with regards to periodontics with my laser. We call this laser guided regeneration. It's a fantastic technique. When I went to dental school, I was told once a patient loses bone to periodontal disease, that bone is never going to come back. That is false. That is not true. We are bringing back bone, no grafts, and solely with treatment with this laser. These procedures are easy for the patient. They may only need a topical anesthesia when we do this. Some people may want to get numb. It doesn't matter. Whatever they like, what makes them comfortable in the situation. However, when they leave here, minimum amount of soreness, yet we are able to regenerate bone, regenerate attachment around the teeth in such an easy way. No cutting of the gums, no surgery, none of this nonsense. It's just fantastic where the technology is going. We're learning that if given the proper conditions, the body can heal itself. And that's what the laser can do. It can make the conditions available so that the body will begin to heal itself, regenerate bone around the teeth. It's a fantastic piece of equipment when it comes to periodontics. Many times a patient may have a cavity underneath the gum. In the old days, well, what are you gonna do? You might try to burn the gum away. If you cut it, it's gonna make a mess. You're not going to be able to fix the tooth at the time. Or you could send the patient to a gum specialist, a periodontist, to expose the cavity so you could fix it. With a laser, basically, it's simple to remove that tissue, expose the decay, get the patient done. They're in and out, no pain, and they're happy. It's inexpensive. One trip, it's done. Lasers are tremendous for extractions. Patients can't believe it. We use a laser around the tooth to facilitate the extraction. These teeth are loosened up relatively quickly. Situations that would normally have required complex surgery become extremely simple. And best of all, when this procedure is done with the laser, the patients experience little or no discomfort. We have a different type of laser. It's called low-level laser, and this is very, very interesting. A lot of the physical therapists are all over this already because we've learned that a low-level laser is very good at treating inflammation in our bodies and whatever the cause of that inflammation is. So, for example, if a patient is having an inflammatory event with their temporomandibular joint, a very common problem, we can treat this with low-level laser and really give them tremendous relief. And or if they're having muscle strain, again, similar fashion, the low-level laser can give them tremendous relief. Another thing the low-level laser does is really help us heal, and most of the sports teams, pro sports teams, have these for that reason. So if they have an athlete who's injured, let's say they had a Achilles tendon rupture or something, and they need surgery, they apply this low-level laser because the patient's going to heal, their athlete's going to heal that much faster. Well, whenever we do a surgery, you're always, be it an extraction, a gum work, a root canal, what have you, we use a low-level laser, and they do heal better. And it's just, having the knowledge, knowing this stuff, having the technology, and putting it to good use, it becomes a win-win. The patient does better, the doctor's happy because the patient's doing better, everybody wins, okay? Lasers, again, it's extremely important. Any dentist who doesn't have one, I think they're selling their patients short.